Assalamualaikum warahmatullahi wabarakatuh and hello everyone. Welcome to the breast cancer types staging and prognosis presentation. I'm Associate Professor Dr. Suniza Jamaris, a Consultant General and Breast Oncoplastic Surgeon at University Malaya. Thank you for joining this course, which has been specially developed for nurses who handle cancer patients. This presentation will focus on what nurses should know about breast cancer, equipping you with the essential knowledge to support your patients effectively. This presentation is part of the Rebung Community Nursing Cancer course. This is sponsored by Fujifilm, Rouge, and MSD. I want to start with an important quote by Donna Wilk-Caldillo. Nurses are the heart of healthcare. This highlights your vital role in patient care, especially in cancer treatment. As nurses, you are not just caregivers, you provide support, education, and advocacy for your patients. Your compassion and expertise make a significant impact on their journey through diagnosis and treatment. As you can see here, these are my outline of lecture, where we start with breast cancer subtypes, followed by clinical relevance of biomarkers, ER, PR, and HER2 status. Then we go to the discussion about breast cancer staging, AJCC staging system, and last but not least, breast cancer prognosis. Breast cancer is not a single disease, but a group of diseases characterized by different subtypes. These subtypes are defined based on the presence or absence of hormone receptors like estrogen receptor, or we call it as ER, progesterone receptor, PR, and the HER2 protein. Understanding these subtypes is crucial because they guide treatment decisions and influence in terms of prognosis. As you can see here from the diagram, breast cancer subtypes are classified based on the presence or absence of three key receptors. What are they? Estrogen receptor, progesterone receptor, and last but not least is HER2 receptor. These receptors play a significant role in determining the behavior of the cancer and its response to the treatment. For example, like you can see in the luminal A breast cancer on your right hand side, it's typically characterized by being ER positive, PR positive, with no overexpression of the HER2 receptor. This subtype tend to have a better prognosis because it responds well to hormone therapies. Understanding these subtypes is crucial as it helps guide treatment decision, ensuring that each patient receives the most appropriate and effective therapy for their cancer treatment. So why is it important for you as nurses to understand these biomarkers? First and foremost, understanding the ER, PR, HER2 status is vital because it allows us to accurately determine the prognosis of breast cancer. By classifying the cancer into specific subtypes based on the biomarkers, we can actually predict how the disease is likely to progress and respond to treatment. For instance, ER, PR positive breast cancer are typically associated with a better prognosis. Because why? Because largely due to the effectiveness of hormone therapies that specifically target this receptor. What are the example of these drug therapies is your tamoxifen, your letrozole that normally we give to the patient with ER, PR positive. HER2 positive cancer, which once had a poorer outlook, have been significant improvement in prognosis thanks to the development of targeted therapies like trastuzumab, or we also call it as Herceptin. On the other hand, triple negative breast cancer often present a greater challenge. Why? Because this cancer lack of ER, PR, and HER2 receptor, so making them more aggressive and limiting the available treatment options. So as a result, triple negative breast cancer tend to have a poorer prognosis as compared to other breast. Knowing the ER/PR status of a tumor is crucial for optimizing treatment options. So it allows us to tailor therapies to the specific biological characteristic of cancer. For example, on your left-hand side, it shows how the ER/PR positive cancers are hormone sensitive, which means that they can be effectively treated with hormone therapies that block the receptors, preventing the tumor growth. HER2 positive cancers, on the other hand, benefit from targeted therapies like trastuzumab or Herceptin, as I mentioned earlier, pertuzumab or Perjeta, and other HER2 receptors inhibitors. These drugs specifically target the HER2 protein, which plays a key role in the growth of these cancers. Triple negative breast cancer, which lack all these three receptors, that's why we call it as triple negative, do not respond to hormone therapy or HER2 targeted treatments. As a result, they often require chemotherapy, which remain the most effective option for these aggressive tumors. By tailoring treatment to the unique biological profile of each tumor, we can not only improve patient outcomes but also minimize unnecessary side effects, providing a more personalized and effective approach to breast cancer. Next, we'll discuss about the breast cancer staging. Staging is a way of describing the extent of cancer in the body, which is crucial for determining treatment options and also predicting outcomes. The clinical relevance of staging in breast cancer is profound, particularly when it comes to managing individual patients. Staging serves several key purposes. First, it efficient identification of local treatment options. So staging helps us determine the appropriate local treatment strategies such as surgery or radiation and based on the extent of the tumor. Second, it assists in identifying systemic treatment options. Beyond local treatment, staging also guides us in selecting systemic therapy. Local treatment means like radiotherapy or surgery. Meanwhile, for systemic therapy like chemotherapy, hormone therapy, which may be necessary depending on the cancer's spread. And last but not least, it provides baseline prognostic information for the patient. It also helps us predict outcomes, tailor follow-up, and care accordingly. According to a study conducted by Professor Nur Aisha et al., published in the Asian Pacific Journal of Cancer Prevention in 2011, there is a significant correlation between the stage of breast cancer at diagnosis and the 5-year overall survival rate among patients treated at UMMC. The findings clearly indicate that the earlier the stage at which breast cancer is diagnosed, the better 5-year overall survival rates, as you can see on your left-hand side. 100% of patients diagnosed with stage 0, or we classify as ductal carcinoma in situ or DCIS, survive after 5 years. Meanwhile, only 16% of patients diagnosed to have a stage 4 disease survive after 5 years. This statistic underscores the critical importance of early diagnosis or early detection and intervention in improving outcomes for breast cancer patients. As healthcare professionals, your role in facilitating early diagnosis and providing timely treatment cannot be overstated. The clinical relevance of staging extends beyond individual patient care. It is also vital for the healthcare system and research initiatives to organize patients into similar groups. Staging allows us to categorize patients into groups based on the extent of their disease, which is essential for standardizing treatment and improving clinical practice. Accurate staging is crucial for clinical studies, research initiatives, and epidemiological studies. It provides the necessary framework for understanding disease patterns and treatment outcomes in larger populations. Finally, staging facilitates the comparison of outcome results across different institutions and clinical trials. By using a standardized staging system, researchers can effectively analyze data, identify best practices, and ultimately enhance the quality of care provided to breast cancer patients. Hence, staging is not only important for individual patient management, but also plays a critical role in advancing research and improving healthcare system as a whole. Now, let's discuss how we stage a breast cancer patient. The most commonly used system for this purpose is the AJCC staging system, which stands for American Joint Committee on Cancer. The AJCC staging system incorporates both anatomical and biological factors. The TNM classification, TNM, stands for tumor, node, and metastasis, remains the cornerstone of staging. This system provides a standardized approach to classify the extent of cancer based on these three components that I mentioned earlier. Tumor size, where this assigns the size of the primary tumor and where it was invaded nearby tissues. And node involvement. This evaluates whether the cancer has spread to regional lymph nodes, which is axillary lymph node, which is crucial for understanding the disease progression. M. This checks for the presence of distant metastasis, indicating whether the cancer has spread to other parts of the body. By utilizing the AJCC staging system, healthcare professionals can accurately determine the stage of breast cancer, which is essential for guiding treatment decision and predicting patient outcomes. When a patient presents with a breast lump in the clinic, a triple assessment is mandatory to ensure a comprehensive evaluation. This process begins with a thorough history taking and risk assessment by the physician or by the doctor, which helps identify potential factors that may affect the patient condition. Following this initial assessment, a clinical evaluation is performed to determine the clinical staging of patient. During this assessment, the doctor will evaluate several key aspects. First, the dimension of the lump are measured to gauge the extent of the tumor. Second, the doctor will assess whether the lump is fixed to the surrounding tissue, for example, to the muscle or to the skin, which indicate more advanced disease. The examination also includes checking for the enlarged lymph nodes, which may suggest that the cancer has spread to the lymph nodes. And last but not least, the physician will look for signs of metastasis to the vital organ, for example, lungs, liver, and also to the bones. This comprehensive triple assessment is crucial for establishing an accurate diagnosis as well as staging, and ultimately guiding appropriate treatment strategies for the patient. The triple assessment also includes imaging studies which are crucial for accurately evaluating the breast lump. Radiologists utilize two primary modalities, which are mammography and ultrasound of the breast. Mammography is an imaging technique is essential for assessing the size and characteristic of the lump, as well as screening for any additional abnormalities in the breast tissue. The ultrasound is the modality particularly useful for evaluating lymph node involvement and differentiating between solid masses and cysts. Once patient is diagnosed with breast cancer, additional imaging studies may be arranged to further assess the extent of the disease. This may include CT scan, for example, thorax, abdominal, pelvis, MRI of the spine, or bone scan to check for distant metastasis and ensure comprehensive staging. By integrating imaging into the triple assessment, we enhance our ability to inform decision regarding the patient's diagnosis and what will be the subsequent treatment plan. As I mentioned earlier, the AJCC staging system incorporates both anatomical and biological factors. Anatomical means that the T and M staging, and biological factors is ER, PR, and HER2 status. T and M staging, which stands for tumor, node, and metastasis, is widely accepted framework for categorizing the extent of breast cancer. T is a primary tumor. It's actually based on the size of the invasive component of the cancer. It estimates of disease volume, and we just take the largest dimension. Now, let's take a moment to analyze this image. Can any one of you identify any abnormalities? Yes, as you can see here, there is a noticeable lump in the right breast. Primary tumor can be staged based on the size of the tumor, whether it's 1 cm, 3 cm, 4 cm, or etc. As you can see here, T1 means the tumor is 2 cm or less across. T2, tumor is more than 2 cm, but not more than 5 cm across. T3, tumor is more than 5 cm across. Whereas T4, the tumor involves muscle or skin or surrounding tissue. Let's take a closer look at this picture. Can anyone identify where the abnormality is located? Is it in the right breast or on the left breast? And which specific part of the breast is affected? Yes, the abnormality is on the left breast. Specifically, you can see there is an erythematous, scaly, and crusted lesion on the left nipple areola complex, which is almost destroyed the nipple itself. This type of finding is significant and warrants further investigation, as it could indicate underlying conditions such as Paget's disease of the nipple, and this can be staged as TIS or T in situ or Paget's disease. Clinical staging for T4 tumors is categorized into 4 distinct types based on the extension of the tumor. Like T4A, this stage indicates that the tumor has extended to the chest wall, affecting the underlying tissues. T4B, the tumor has invaded the skin, which can manifest as ulceration or other changes in the skin's appearance. T4C is classified as when there is a combination of both chest wall and skin involvement. And T4D, this stage refers to inflammatory breast cancer, characterized by rapid changes in the breast, including swelling, redness, and pudor-orange. Understanding this classification is very important for determining the appropriate treatment strategies and prognosis for patients with advanced breast cancer. These pictures show one of my patients who presented with a T4B tumor. So what is T4B tumor again? It's indicating involvement of the skin in the right breast, especially at the upper outer quadrant. In this case, you can see actually a bleeding ulcer accompanied by a multiple hyperpigmented skin nodules. These findings are indicative of advanced disease and highlight the aggressive nature of T4B tumors. Take a look at this picture. Can anyone identify the problem presented here? Yes, there is an abnormality on the skin that looks like the peel of an orange. That's why we call it as a pudor-orange. This appearance indicates an advanced disease, and if a patient presents with this condition, she is at least stage 3 disease. Here we have another picture of my patient focusing on the right breast. Look at the right breast. You can compare with the left breast, which appears normal. And you can see in the image, the right breast shows signs of being plastered or stuck to the chest wall. And also you can see there is an abnormal fungating mass on the nipple and hyperpigmented skin. This presentation is characteristic of a T4C tumor, where there is involvement of both chest wall and the skin. These pictures depict the appearance of inflammatory breast cancer. As you can see, the entire breast is noticeably red, which is a hallmark sign of this aggressive form of breast cancer. The redness is typically accompanied by other symptoms, for example, like swelling, warmth, and skin changes. Inflammatory breast cancer is characterized by its rapid onset, which is less than 6 months, and can often be mistaken for an infection or other less severe conditions. Let's turn our attention to breast cancer prognosis, which is our last topic. Prognosis refers to the likely course and outcome of the disease, influenced by various factors, which include the stage of the disease that we already discussed earlier, biological factors, which is your ER, PR, and HER2 status, and the histological grade, whether the grade 1 or grade 2 or even the grade 3 disease, and the patient factors. It means that individual patient's factors, which is their age, overall health, and response to the treatment, which all these may contribute the prognosis of the patient. Understanding these factors helps healthcare providers communicate effectively with patients about their diagnosis and treatment options, and allow for informed decision-making and personalized care strategies. The stage at diagnosis is very crucial and important in determining breast cancer prognosis. As we know, the earlier the stage, the better the prognosis of the patient. Why? Because they are more treatable and have a lower chance of metastasis. But unfortunately, many of our patients presented late at stage 3 and stage 4. This late presentation contributes to the poorer 5-year overall survival rates compared to those in developed countries such as United States or Japan or even our neighboring countries like Singapore. The biggest challenge in treating cancer patients in Malaysia is the late stage presentation at diagnosis. The Malaysian National Cancer Registry has reported an alarming trends regarding this issue. There has been an increase in late-stage breast cancer diagnosis, rising from 43.1% to 47.9%. We are also seeing similar trends in other cancer, for example, like colorectal cancer, cervical cancer, and also lung cancer. These statistics highlight the urgent need for improved awareness. Early diagnosis or early detection is important for better survival outcomes, improved experience of care, reduce morbidity from cancer treatment, and improve quality of life. As what recommended by WHO, important cancer control strategy for middle-income countries without organized screening is with the early diagnosis. Let's deepen our understanding of breast cancer anatomical staging. As you can see here, stage 0, this stage is characterized by ductal carcinoma in situ, which is non-invasive, and this stage cancer cells are confined to the duct and have not spread to the surrounding tissue. Stage 1, at this stage the tumor is small, typically measuring up to 2 cm, has not spread to nearby lymph nodes. Stage 2, the tumor may be larger, ranging from 2 to 5 cm, or it may have spread to 1 to 3 nearby lymph nodes. Stage 3 indicates a more advanced local spread. The tumor may be larger than 5 cm and may have spread to multiple lymph nodes or even the chest wall or skin. Whereas in a stage 4 disease, I think everyone should already know that it's already spread to other organs, for example, like lungs, liver, or bones. And based on this anatomical staging, the earlier the stage, the better prognosis of the patient. The AGCC8 system goes beyond anatomical consideration by incorporating key biological factors including the ERPR and HER2 receptors, as well as the grading of the cancer. Based on the biological staging, generally the hormone receptor positive patient with HER2 negative has a better prognosis. The HER2 2+ variable, it improving with the targeted therapies that I mentioned earlier, the Herceptin or trastuzumab, whereas the triple negative generally has poorer prognosis. According to a study published in the Journal of Cancer Epidemiology in 2014 by Paris et al., the biological types of breast cancer play a crucial role in determining patient prognosis. As you can see here from the graph, luminal breast cancer subtypes exhibit significantly better survival rates as compared to the triple negative breast cancer. This disparity in outcomes underscores the importance of understanding the biological characteristic of breast cancer when formulating treatment plans. The histological grade is a crucial factor that helps predict the behavior of the cancer. The grade of cancer, which indicates how abnormal the cancer cells look like under a microscope. It also impacts the patient's prognosis. In general, the lower the grade, the better the prognosis. Like DCIS is graded on a scale that typically includes low, intermediate, and high grade. When it comes to invasive breast cancer, the recommended method for assessing histologic grade is Scarf-Bloom-Richardson at SBR grading, specifically the Nottingham modification. This grading system evaluates three factors, which are tubule formation, nuclear pleomorphism, and also mitotic activity. Each of these factors contribute to the overall grade, which helps classify the tumor as grade 1 to grade 3. Do not confuse in between staging and also grade. Understanding the histologic grade of invasive breast cancer is crucial, is important for predicting prognosis and determining appropriate treatment strategies. Remember, the higher the grade, the poor prognosis of the patient. As you can see from the graph, the luminal subtypes of breast cancer demonstrate differing prognosis based on tumor grading. It means that grade 1 and grade 2 tumor tend to have better outcomes compared to those with grade 3 tumors. This distinction highlights the importance of histologic grading in assessing patient prognosis. Lower grade tumors are often associated with slower growth rates and lower likelihood of metastasis, making them more amenable to effective treatment options. In contrast, grade 3 are typically more aggressive and have a higher risk of recurrence. This emphasizing the need for tailored treatment strategies based on tumor grading. As we conclude, let's focus on what are the key take-home message and what is your role as nurses. In breast cancer subtypes, understanding these subtypes, which are the ER, PR, and HER2 status, is crucial for selecting appropriate treatments. You play a key role in educating patients about their specific subtype and the treatment option available. It means that if a patient has ER positive, it is necessary, it is advisable for them to continue their letrozole for at least, for example, 5 years. No? Staging determines the extent of disease. Your ability to explain the significance of staging helps patients understand their condition and treatment rationale. As I mentioned, the earlier the stage, the better the prognosis. Prognosis is shaped by both the cancer's stage and its biological characteristic. Clear communication about this can provide patients a better understanding of their journey. Treatment should be personalized based on the cancer's specific characteristics. Your advocacy ensures that patients receive the most effective therapies. As nurses, your knowledge and skills are vital in supporting patients throughout their breast cancer journey. With that, I end my presentation with thank you. Thank you for your commitment to improving patient outcomes. I would also like to acknowledge the generous support of our sponsors, Fujifilm, Rouge, and MSD, for making this presentation possible. Your dedication and hard work truly make difference in lives of those affected by breast cancer. Thank you.